So let's dive right into this. We have with us Therese Canares, who is the CEO and founder of Curie DX, and along with Larry Trotter, the brains of this operation, at least from the podcast side of things. And today we're going to talk about physician-led startups. And Therese, tell us a little bit about Curie DX real quick.
Yes, happy to. So thanks for having me, guys. I am Dr. Therese Canares, CEO and founder of Curie DX. I'm also a kids emergency doctor at Johns Hopkins. And what I'm building at Curie came from what I saw in the emergency room. So I would have families wait days to be able to be seen. And then they'd get to the ER and then wait hours more until a room was open. And part of the struggle here was not just access to care, it was access to diagnostic tests. So my team and I created a way to predict diseases like strep throat with just a picture and computer vision. We're starting with strep, we're moving into pink eye rash, urinary tract infection. So we're thinking of this like a lab in your pocket. So that is Curie DX in a nutshell.
That to me, I'm working with Therese a little bit on some sales stuff, and one of the things that's really compelling about this is it's not a point solution, and it's going to have a series of applications and diagnostic abilities that are going to that I think will give it traction inside the primary care facilities.
And
But go ahead, Larry.
I was going to say, and I'm glad it helps alleviate that problem for not being able to see a physician for months, down the line, because I've experienced that a lot recently. I don't go to the hospital often, but it's almost ridiculous. I get why it's going on, but it's kind of ridiculous.
Yes. Yeah, totally. It's not even easy to get into primary care sometimes, like just for like a regular checkup.
That's what I mean. Yeah, exactly. Exactly.
Yeah. So this ultimately is going to be almost like a diagnosis in the home. You'll be able to do these things in the home and then communicate with the physician.
Yes.
And then may not, and so telemedicine is going to be, it dovetails really into telemedicine. So with that in mind, though, you would think, oh, this is just a slam dunk. It's got to be so easy to sell. And yet it's not. And you want to kind of elaborate on that, Therese?
Yeah, yeah, absolutely. Well, sales, I am being a relatively early stage startup. I am also head of sales. And what I am learning through the sales process is, first of all, sales is really fun to learn. It feels like a little bit like a game, because there are some rules. There's a playbook to follow, and so I am. It's my first foray into sales. So Brendan, you spent a career here. Correct me if I'm wrong, but it seems like if you learn the playbook and practice the skills, you can be great at it. Like you don't need all the degree. I have way too many degrees, and you don't need all the degrees that I have to be a great salesperson.
Yeah, that's right. And it's understanding some basic fundamental things and having the right mindset and yeah, that's all true. That's all true. And the important thing, and you're kind of an embodiment of this, and that is if you're a founder and you're starting out, you really should be you should be doing sales in the beginning for a number of reasons. And because you're seeing everything firsthand, you're getting a lot of feedback, you're hearing things in the language of the people that are going to be your ultimate users and evangelists.
It's
Yeah.
also
So
one of
go ahead.
I say, like, one of the beauties of entrepreneurship is in the beginning you have to wear so many hats, and you do kind of discover other avenues that you wouldn't have given attention to before, because marketing is like that for me, right? You know, Same thing as my company's been around for 5 years, but essentially I have to do the majority of the marketing. But once I started learning to do it, I actually found writing therapeutic and fell in love with it. So I understand exactly what you're saying.
Yeah. I
So
can I
so
can share an
yeah, go ahead.
early example of this, of the kind of figuring out and learning to embrace the process of sales. So you may have, or other folks may have heard of, the lean startup and iCore,
Yeah.
which is, iCore came from Steve Blank's work on lean startup, where, like the NSF and NIH have created iCore programs where they coach scientists or who people who are originally the inventor to understand their customer's problem before they start building the solution. Often it's the solution's already in progress, but they want to make sure those builders, those technical people, know the pain points of their customers before they try to launch the whole solution. And I remember early on, this was way, way before what I'm doing now. I had started off with a research team at Hopkins, we were creating an otoscope that could look into the ear and detect ear infections with a tiny digital camera. And we thought we were so brilliant. And wow, what if you could detect ear infections on your own from home immediately? Like that, wouldn't that be incredible? And so I went through iCore, and that was my first foray. I think customer discovery is sort of the initial foundation of learning
Right.
sales.
Yeah.
So I went through iCore, I learned what customer discovery was. And I did it all wrong. So first I went to my pediatrician friends who, because they're easy to access. Like I know lots of doctors. So I'd say, hey, pediatrician friends, wouldn't it be great if you could diagnose your infections easier on the otoscope? And, like you're not supposed to talk about your solution. You're not supposed to give them leading questions
Right.
that lead to them saying, yeah, I guess. And of course, they would say, I mean, yeah, I suppose that'd be nice. And I would hear, yes, they like it. And then I'd say, "Great, how much would you pay for it?" And they're like, "Oh, I don't know, $100." Like, I never should have been asking them in the first place. As soon as I got the facial expression of, I should have stopped there and backtracked. So I rectified that. I ended up going to a Facebook moms group. I just typed in, "Does anyone struggle with diagnosing ear infections in their kids? Is anyone looking or not looking, but do you wish that there are ways that you could find out if your kid had an ear infection faster?" And the replies were incredible. I mean, it was like message after message after message of, we struggled with this for years, and I can't tell you how many times we had to go to the doctor for this, and it's always Friday night at 8 p.m. And the enthusiasm around solving this problem was so strong. And that's when I started to figure out, like, okay, this is how you do it. Don't
And
talk
I
about the
hear
solution.
I hear so much about these Facebook mom groups, especially
Oh,
from
you could
Shark
join
Tank,
one.
so I guess they actually work.
Oh, well, and remember, you don't ever lose sight of the fact that moms are the primary care
Very
healthcare person in
yeah.
any family.
Yes. Yes. So we know that societally that it's not a universal trend, and it's not 100% of households, but many homes, the female in the home is often the decision maker for healthcare, the one who's taking the responsibility of making appointments and bringing household members, whether it's elders, siblings, children, and being responsible for their healthcare decisions. What I learned recently though is, so we know that behaviorally, women tend to take the lead on this. But what I learned recently is other folks in industry, like other businesses, look at a lead capture of a female patient with significantly higher lifetime value for that business. Because if a female clicks on your ad, then the lifetime value of that new customer, that woman is bringing along their entire family of five.
Yeah,
That makes
that's
sense.
fascinating. That is, and that's yeah, and that makes perfect sense because they are aggregating for every one of the kids and probably their parents, right? They're oftentimes and other so they are the kind of the hub for. So you've got you're a doc and selling and like what are the sorts of things you're running up against in the customer setting?
So it's a combination of I'll share the feedback that I'm getting from customers, but what am I running up against? It's also me upskilling myself and learning. I'm drinking from a fire hose to learn, all of the foundational pieces of sales because it's been done before. I'm not reinventing the wheel here. I just need to read the playbook and practice the playbook so I can continue to get great at it. One of the things that I've learned, it's not necessarily a challenge, but one of the things that I observed is I'm talking to a lot of physician owner operators. So relatively smaller practices, fewer decision makers. I'm talking to usually the person with buying power is often the CEO, the president, the owner, who's also often a physician. And I'm finding that I'm able to build rapport quickly. There's immediate trust. We're speaking the same language,
Right.
and I understand their pain points and their perspective from multi dimensions. And so that seems to be going well. What I learned talking to other folks who do sales also in the healthcare industry is they'll often do a two-person tag team where there'll be a salesperson and a clinical person, like a physician assistant or other physician. And the two of them are going in to close sales. And, the salesperson does all the sales techniques, and the clinician person probably says the same exact thing, but it's received differently because it came from someone with clinician credentials. So one of the things I'm learning is I can do both,
Right.
Yes.
which is awesome, except I
Yes.
alone don't scale. So I do need to grow the team.
I was gonna say, right, because you are a physician and So almost, I feel like you're almost selling to yourself in a sense, right? Because you're the buyer and you understand. You really have like a leg up.
Yeah. Yeah,
Yeah,
absolutely.
it's great.
It's definitely
So
a superpower.
what are the sorts of things that you see as being obstacles? So you're trying to identify the specific things that are going to say, oh, this makes financial sense for my urgent care center or for my practice. What sorts of things are you running up against?
Great question, Brendan. So, the things that we highlight as far as value, how do we support a clinical practice? I'll give you one example. One component is time savings. Like, I am certain that by being able to identify, we'll take strep throat, which is our first use case. By being able to identify strep throat on virtual care when the patient's home, that means the patient doesn't have to spend 2 hours door to door going to clinic. The clinic doesn't have to spend another, 15 minutes of intake of this patient who came from telehealth, but now is coming in person and doing their swab, then waiting for the results, then or calling them back. We're streamlining that whole process. Because we're fairly early, we're in our first few customers. I don't have the hard data to say this is like we've time clocked it. I know exactly how much time you save. It's a little bit more projections and hypothetical. So I feel like it's not necessarily an objection, but that's a struggle that I feel internally. If I'd love to be able to say, we've been doing this for X months, X years, X thousands of patients, and here's exactly how much time we save. So it's examples like that where we don't we don't have the data yet. We're getting it now, but that will definitely boost the conversation forward.
Because
Yeah,
isn't ROI very important in the healthcare setting
For sure.
when they're buying these new? Because that's what I keep on hearing. My ears to the ground is, especially, and I'm sure we'll get into in a little bit, Therese, but AI, especially when you're selling these AI products, right? The clinicians, the workforce, physicians want to know, okay, this looks good, but what's the ROI on it?
Right. Yes, and a part of that too, I'm glad you brought that up, Larry. So part of that too is what we are building is considered software as a medical device. We've launched it as a screening tool, like clinical decision support. So it's supporting the clinician with some degree of risk prediction. We are simultaneously in parallel bringing this through FDA as a diagnostic. And the steps on that journey are, getting through FDA as a diagnostic, then amending a CPT code so that we can enable billing and reimbursement. That process is a multi-year process between FDA, CPT, billing, reimbursement. And so part of the challenge is, okay, then what do we do in the meanwhile? How do we make sure that we are a viable company, that we generate revenue and so on?
right. Good.
Which we are successful at doing. We are closing contracts, we are generating revenue, but a really compelling part of the ROI story that we can't do yet is, use our test for X number of dollars, you'll get $15 in reimbursement. So that reimbursement piece on the ROI front is coming, not there yet. And so we're thinking of other creative ways that we give ROI back beyond just the billing piece.
But and here's the cool one that really kind of out of the box kind of thinking that I think applies to Curie DX, but also applies, others that have a health tech solution, especially in a consumer facing world where the somehow or another the consumer, the patient is involved is it actually drives SEO traffic
Mhm.
and new customers, because if you think about it, the convenience of this for, the patient, you're a mom with a kid that's sick and might have strep throat, and you wanna figure out whether or not I need to drag the kid in. This is something that, "Oh, I know that this urgent care center allows me to do this. I can download the app and boom, I can self-diagnose, not self-diagnose, but I can get the urgent care center to diagnose this and say, 'Oh, you really do need to bring the kid in.'" And that
Via the app?
will drive traffic to that urgent care center.
Yeah.
And then you create a competitive feedback loop because the other urgent care centers in the same geography should offer that same tool, or they're gonna be at a disadvantage because what? Strep is 8 or 9% of the
Mhm.
throat conditions are not 8, 9% of the diagnosis of the condition of the cases that they see in a given urgent care center.
Yeah. Yeah, that's 100% true. That's one of the stronger selling points that's attracting practices to sign on, which is the ability to be able to say, and we actually we do have data on this where we've run ads campaigns where the like Google ad keywords are things like check strep at home or stay in your PJs, check for strep, painless, swabless, strep screen. And with that kind of language, our cost per acquisition and our click through rate is incredible, which means we are helping exactly what you said, Brendan. We're helping drive traffic and drive new patients to urgent cares and primary cares. And in the urgent care space right now, their margins are thinning as insurance reimbursement lowers. So the way they win the game is volume. And sometimes one patient is the difference between break even and profitability for that day. So when we can drive new patients, especially a mom or a female, that's a huge win for the practice.
And one quick clarification, when someone is checking at home, they're using the app. Is the urgent care responding via the app so they don't have to go into the actual urgent care?
Great question, Larry. So yes, the urgent care. So our practices who partner with us, our customers, are urgent cares and primary cares. They are using their own telehealth platforms that they're already on
Okay.
to communicate with the patient. So I'll give you an example. Let's say you have sore throat. We built this for kids and adults. So let's say you have sore throat. You log in to let me rewind. You are searching for an urgent care and you sign up with your local urgent care. If that urgent care is one of our partners, they'll say, "You're here for sore throat. We'll do a telehealth visit. Can you use the Curie app and label our practice as who to send it to within the Curie app?" And then
Okay.
when we have that telehealth visit, the physician can see it on their end. So when the physician gets a notification that says, "Larry sent in the throat image, here's the strep prediction." And when you're interfacing through the normal telehealth pathways, your clinician will see it on their end.
Got it. Okay.
That's pretty cool. And that you can see how someone like I'm paging through the phone book or Google, actually more Google. I'm looking at Google and I'm trying to find a urgent care center, and this one offers telehealth solutions. I can diagnose, without going in. And boy, that's a nice.
100%.
So where's the security component in all this? I mean, let's weave Larry in because like how do you folks deal with the security element?
Well, there's a number of layers here. I mean, the standard is maintaining HIPAA compliant protocols, and what that looks like for an organization like ours. Like for example, we're dealing with throat images. So we have developed models internally that, one of the first things it does is it's going to cut extraneous parts of the image out of the view, anything that could be a potential identifier. And so we're stripping out anything that could be a direct identifier and or is irrelevant to the machine learning model doing its analysis. So there's layers of techniques that we have to ensure that identity remains private and is not shared even within the team.
So when it comes to the FDA approval process, in 2024, they finally made requirements for medical devices from a cybersecurity context. And one of the reasons I'm sure they did this is because we all went through the IoT craze where these devices were deployed in health system settings, but they didn't have any native security features, and it created a whole another bag of issues, right? So now they have the cybersecurity requirements in the FDA. How are you guys navigating that?
Are you offering consultation services, Larry?
We got there already. You know what? Yeah, for a limited time on December 3rd, I'll be yeah, go ahead. But sure, I'd be happy to talk. But I just I know you're kind of going through that process now, and I've heard it can be daunting and challenging. So
So far the biggest thing for us has been completing all of the elements to ensure that we maintain HIPAA compliance. There's certainly other deeper cybersecurity pieces that are probably more in my CTO's wheelhouse,
okay.
but it hasn't come up as a challenge as much as okay, let's figure out how to make this work.
And I know you said it hasn't come up as a challenge. This like really leads to my next question. How concerned are your customers about it? Is that part of the conversation when you're selling as far as, how are you securing this device or your application and the privacy concerns? And especially because your app uses AI, right? Right. And okay, we talk about biases and trust and AI governance. How much is of that is coming up in the conversation, if any at all?
It's actually not. As far some folks ask, how is the data used? And of course, we have terms and conditions and a privacy policy that every user has the ability to read through and must sign off on. Um, but for example, a lot of folks think that when they think of AI, they think of the ChatGPTs and the Claudes and the Groks and the large language models using public foundational models for our data. Our data is remains stored in-house on we're on AWS, so we
Mhm.
follow a lot of the AWS security protocols as well. But our data and our patient data is not sent outside of our own internal systems.
I know, Therese, I know you have to go, but before you go, how does like if you're an urgent care center or you're a doc that's in this space, how do they reach out to you? LinkedIn or what would
Oh,
you like
thank
to?
you. Thank you so
Sure.
much. Yes, LinkedIn is great. You can email me tcanares at curiedx.com. So TCANARES at CURIEDX.com, or they can message you and you can tell me.
Yeah, very good. All right, very good. Well, thank you so much, Larry. I'd like to stick around for a little minute, but I know that Therese has to go. Dr. Canaris, is great having you,
Yeah, thank you.
and and we'll good luck with this.
It was such a joy. Thanks for having me. I'll see you guys soon.
You bet.
Bye.
Good luck.
So one of the things I took away from that is that this is a completely different kind of AI than what everyone
Right.
the user everyone that's the rage now, these large language models. This is not what she's working on. She's working on stuff that's image processing and machine learning and that sort of thing. So that's kind of fascinating.
It went by way too fast. I can't believe we were at 9:30.
Yeah. Hey,
Okay, I had yeah, it just, the whole founder's journey, I had stuff I wanted to talk about that and then
well, we can
diving
always have
into
her back. We can easily have her
yeah,
back.
we should.
She's great.
That
She's
was
a lot
quick.
to add, and I think what the things that's really kind of fascinating is they found a way to go and use and get revenue in advance of FDA approval. And I've got another customer that I'm working with now that's in the same space. That's not in the same space, but it's doing the same sort of thing. They figure out a way to create a diagnostic. They've got a diagnostic tool, but they have a way to apply it before then so they can get revenue and get installed customers and get adoption and case studies and that sort of thing
Is
early
this
on. So that's a critically important thing.
it is, and because I was never aware that the process took, years. Do you have any insight or expertise around this? That was one of the questions I wanted to ask. How do you go to market with the diagnostics tool that hasn't been FDA approved? Do you know?
Yeah, so it depends if you can use it in some sort of supportive way. Number one, that's probably the easiest. Is can the tool in and of itself, or can your solution in and of itself deliver enough value that people are willing to use it in some sort of complete, suboptimal way? And that's her application does that. And June Brain, these other folks I'm working with, they have an application that the accuracy is high and the reliability is there and it delivers enough value, and they can kind of figure out ways to, that's one of the things I wrestle with and help them with is how can you find specific ways to articulate the value so that there's enough reason for someone to say, oh yeah, I'll do this, because it's, they're the kind of adopter that likes innovation. They want to set themselves apart. They do
Early
something.
adopters? Would you
Yeah,
say
early adopters or what have you, and or they have a very particular problem. And so in the course of some of this discovery, if you can find out who has a problem that's other than, one second, I got to turn my phone, other than, the complete solution. Maybe they have a problem that part of your application is good enough that it does satisfy that thing. And if you can during the discovery process ask the right sorts of questions and pay attention and listen, you might hear some instances where you've got a way to roll out an incomplete solution that has enough value that people will pay for it.
that could be another episode in itself. I'm
Yeah,
sure
yeah,
that would be of interest to a lot of people in the audience. But yeah, that's
yeah,
very interesting because I was trying to wrap my head around it, but that makes sense.
yeah.
Yeah, and she sounds like she really listens to and understands her customer and really
Yeah,
takes that information and,
yeah.
you know
She's not only she's smart, she's like, one of the things about docs is they have a tendency to know everything, or they, because they're very educated, right? Uh, they've got a lot of experience, and, they've thrown into the deep end of the pool, right, over and over and over again. And, but she's been one of the things about her is she's very coachable. And,
Mm.
that's been really one of the fun things. One other thing before we drop off, that kind of I'm taking off in a different direction that we hadn't even talked about. But I just heard this the other day, and this is going to be an interesting problem for healthcare, and that is the current administration has done some stuff where they are now not allowing, they're not designating certain medical professions as professions.
I've
And
heard about
so,
that.
right? And so that means you can't write off or get benefit for your investment in your education. And the ones that are particularly worrisome for us in healthcare are nurses.
Yeah, that's what I
Nurses
heard, that nurses
and
no longer
PAs, physician
that's what
assistants.
it was. It was physician assistants. They are no longer classified as medical workforce
Right,
clinicians.
that as professionals, so they don't get to write off as much of their, they don't get the same. So if you're a doctor, you still get it, but if you're a nurse, that's been taken away. And for physician assistants, this is gonna, if this doesn't get addressed, this is a huge problem because
And
we
so what
are.
does that mean again? Like, so you're not recognized as a professional. What does that mean?
It means that you can't write off the benefit, the investment you make. You can't take advantage of the benefits that come from, grants and other monies that you can use to. And I'm no expert on the financial component. I should have researched this more before I brought it up. But what it means is you don't get the financial advantage that a physician does in terms of the investment they make in their education. And so because they're not a professional, they're not considered a professional, they don't get that. And what it's going to do is it's going to create a further disincentive to become a nurse or a PA. And this is absolutely something the hospitals and clinics are going to have a hard time with, because if you can't get nurses, we're really hurt. Really going to
So,
be hurt.
okay, so this is going to affect nurses too. What is the
Absolutely.
what is the reasoning behind this?
So I think it's money at some point. So like it's a way to cut, to, I don't know, to save money, for the government. I don't know the logic. It doesn't make any
So
sense.
another way to ruin this already ruined system.
Yeah. Yeah, it's gonna make things like Therese's solution more attractive, because there's gonna be fewer and fewer nurses and PAs to kind of do some of this diagnostic work. But on the whole, it's gonna be a problem, because we're woefully understaffed.
Right, already. There's
Yeah,
already a shortage.
yeah,
Now
yeah,
there's gonna be and even more because, like you said, no one's gonna have an incentive, like, to want to be
yeah,
a nurse
yeah.
or
I'll
physicians.
do some more homework on this, and we'll talk about it more. But this is the thing. This is the thing. The big beautiful bill and what's going to do for Medicaid reimbursement is really going to be a problem. The fact that we're now talking about reinstating the subsidies for Obamacare is going to be. We live in interesting times, Larry.
We are, my friend. We certainly are.
All right.
I rely on you for the news. I can't watch that stuff anymore.
Until next week or 2 weeks from now, right? Do it again.
We might do it next week, everybody. Yeah,
Yeah. And certainly in
let's talk
January.
about that.
Yeah, certainly in January, we're gonna do every week. The demand has
Absolutely,
been
yeah.
the demand has been incredible.
Can't keep up with all the fan mail. Everybody, thanks for joining. Can't wait to see you next time.
All right. Thanks. See you.
See ya.